people still coming in. Trying to watch 2 or 3 screens here at a time. um, or 2 or 3 windows, I guess. I want to welcome everybody to week 3, the third in our series of ShopTalk with Sublime. We're doing a weekly webinar series. We're doing 6 weeks, so we're halfway done. So excited for all of you all to be here with us today. We've got some guests on with us today, so really excited about what we're going to learn today. Want to make sure, I guess I'll ask, I know I've got everybody muted as they're coming in, and that's just kind of keep down on interference and background noise and that kind of thing. So please, I know Rachel Villanueva is with me today, and Adam Bell with Sublime Computers is also with me today. Their mics are on, just as a reminder for y'all. But also, if you all can just let me know, do you all see my screen? ShopTalk with Sublime, so we can just make sure that everybody's seeing that before we get going. Like I said, still got people coming in, and Adam, can you see my screen? There you are. Can you see my screen?
Yes.
Okay, awesome. Well, as people are coming in, like I said, my name is Elizabeth Bell. I want to welcome you. We'll hit just a few little pieces here just to get started for the record. I don't have to tell you all we're kind of living in a really weird time right now. Living in a pandemic, we're sheltering in place, or we're transitioning out of a shelter in place. We've really lived in a virtual world over the last few weeks, couple of months, depending on where you are, longer for some people. We at Sublime Computer Services, we're an IT company. We do managed services for our clients. We are the IT department for our clients. And so we have really been busy over the last few weeks, making sure that people can connect and get online. We got through that initial rush of everybody getting online, and we decided that we needed to sort of shift gears. We needed to position ourselves really to be people who are a company that gave advice and education and really helped people work virtually and work successfully while they are working remote or virtually. And so that's really where Shop Talk with Sublime, this webinar series, really was born, because we wanted to be able to share information about technology, about working from home, but get information from other people. With this webinar series, what can you expect? Well, we are going to have informative discussions, relevant discussions. We are a tech company, so obviously we'll hit some technology as we go along because that's relevant for what we do. But we also want to hit some HR issues, compliance issues, healthy living issues, those type things. So we're going to touch on a lot of things. Viewed from 10,000 feet, what do I mean by that? Well, obviously we're not going to hit every single detail. Can't do that in an hour. So we hope to give you plenty of information and places to go to get more information if you want to learn more about the topics we discuss. We hope this is going to be positive. We hope it's going to be entertaining for most people. We don't want to put you to sleep. We do want it to be interactive. So please, put information in the chat, or at the end we are going to have some question and answer. So please take advantage of the experts that we've got on with us, especially today. We are doing this weekly for 6 weeks, and that's going to be on Thursdays at 2 o'clock Central. And then starting in June, we're going to have this on a monthly basis. So we hope you can join us. How do you join the fun? Well, obviously, if you're with me today, you've figured that out. You've registered with us. We are going to be recording these sessions. So if there's one you've missed or you have to jump off early, you can catch this recording and other recordings. We are putting this on our YouTube channel and our social media. How can you connect with us on those? We have Facebook, Twitter. I know Rachel has all that as well with the benefits group and the doctor that we have. Everyone's connected on internet. So we would love for you all to just follow us and like us and also catch up with some of these webinars. As far as topics, today we are going to be talking about telemedicine today on the 30th, but here you can see some of our upcoming webinars. If you have suggestions on topics that you would like to hear about, technology related or not, please let us know. We'd love to talk about things that are relevant to you. So please send us that information. Let us know what you'd like to hear about. So who are you hearing from today? As I said before, my name is Elizabeth Bell, and I guess I'm your virtual host today. My official title at Sublime Computer Services is Vice President of Business Development, but I'm like most people. We wear a lot of hats in our different companies, and so I do a lot of different things. I do client education. I do some of the back end things as far as, you know, networking and marketing, those type things. My hardest job is keeping our president in line. I'm married to him, so it's a little bit easier. But my husband, Adam, who I said earlier is on the call with me, he kind of keeps me in line on the technology side. So he'll be chiming in as needed today. With me today is Rachel Villanueva. She is the director of the benefits group. Rachel, if you want to tell them a little bit just quickly about yourself and what you're going to bring to the table for us today.
Sure, yeah. So here at the Benefits Group, I'm the director of the Benefits Group and Solution Point Consulting. Solution Point Consulting is a tech-based business development consultant firm. The Benefits Group has kind of formed because they are so important for businesses today to offer some sort of benefits. There are a lot of solutions that you can offer a group situation. So that's what we do. We put together plans that are Fortune 500 benefits for small to mid-sized businesses across the Southeast. And yeah, we also, you know, because we deal with a lot of small businesses, we also do deal with their employees on a personal level. So we do health, life, and retirement planning for both individuals and small and mid-sized businesses.
Yeah, Rachel and I met at a networking, I guess a medical managers group meeting last summer, and she's got a lot of passion for HR. So I'm excited for her to share that. It is important. It is important, but I love it that you're passionate. Our other guest panelist today is Dr. Janice Riley-Burt, and Dr. Riley-Burt is the owner of Integrative Medical Doctors. They're located here in Nashville at the St. Thomas Midtown complex, and she really focuses on total body health, very personalized diagnoses and treatments. She has been doing telemedicine actually for the last couple of years since this new practice opened. So she was on the bandwagon way before it really got going as it has under this pandemic. Because of her very large practice and the busyness that she's seeing right now, she actually, unfortunately, was not able to join us live today as we had expected, but she has recorded a video. So she has recorded a video for us to see, to share her expertise and her experiences using telemedicine. So it's not as good as live, but I was very thankful that she could still do that for us. So let's get on into the meat of the presentation here. So telemedicine, who, what, why, when, where, and how. That's what we're going to talk about today. So what exactly is telemedicine? The World Health Organization, their definition is healing from a distance. And I like that terminology because I think it makes it still feel like you're getting that personal care, and you do from telemedicine, just in a different way. So healing from a distance is the definition that they use. You also will hear the term telehealth, telemedicine, telehealth. Those are kind of used interchangeably. However, there is a little bit of a difference. Telemedicine is the actual service of delivering the medicine, of delivering the healing and the diagnosing. Telehealth, according to the This is from healthit.gov. That's the Office of the National Coordinator of Health Information Technology. So they're the IT people for the health department, the government health department. Their definition of telehealth, and I'm going to read it because it's kind of long, is the utilization of electronic information and telecommunication technologies to support and promote long-distance healthcare, health education, public health, and physician education. So telehealth is not the service, it's really the means to an end. And it really is an all-inclusive term. It includes telemedicine and the televisits. It includes monitoring devices like CT scans and pacemaker reading, EKGs, blood sugar monitoring, and also the patient portals. We've all now experienced, we have to put in for our refill requests, or we send a message to the nurse because we have a question. So that is part of telehealth as well. It also includes parts that are non-clinical, so the actual scheduling is part of telehealth, and it also includes continuing education for not just the practitioners, but education for the patients as well. So it's really more of an all-inclusive term. There are lots of benefits to telemedicine. Rachel's going to touch on those as well, but just, benefits with doing the telemedicine can include a lot of things. One is that it is interactive. I think people kind of have this idea of it being very cold and impersonal, but it is very interactive. You have real time with your doctor. It's great if you have a really busy schedule and maybe you can't get there and you can just go into your office on your lunch break. It's great if you live a long distance from your physician and you don't want to have to go back and forth. It's great when you're on vacation or out of town. It's great when there's a pandemic and you have to be at home and you have to stay 6 feet apart. And so there are times when it's not appropriate. Emergency situations, you've broken an arm, you're having a heart attack, those type things. Telemedicine is not the way to go. You really need to think more of, I have an earache, or my child has pink eye, or I'm having some diarrhea, stomach upset, cold and flu symptoms. Those are the kind of things that are wonderful for telemedicine. Also, they're using it now a lot in dermatology and also in psychotherapy. So you can get counseling sessions one-on-one with your physician. So lots of ways that you can interact with your physician on televisits. There's also the benefit of remote monitoring. So if you have a pacemaker, you have a blood sugar monitor, you've had an x-ray done or a CT scan and you have to wait a couple of days for your results, they can call you and visit with you about your results. There's also the benefit of storage and forwarding the information. So if you see your primary care doctor and they do feel like you need a specialist, they're able to quickly and securely send that information from their telehealth to that hospital or the doctor. So lots of benefits as you are doing telemedicine. Quick history. I know there's a lot of information on this slide, but the concept of telemedicine and electronic medical records really isn't new. If you think about it, back in the 50s, as people were starting to get phones in their home, you could call up your family doctor, the local town physician, and get advice from them. And so really that was the beginnings of telemedicine. Fast forward to the 60s and 70s, you started to see the first electronic health records that were present. At the Mayo Clinic, they've always been innovators, not just in medicine, but in records. In the 70s, Lockheed Martin, which we know, of course, for aeronautics, they actually invented the first electronic health record that was used commercially. It was called Eclipsis. That now has become Allscripts, and Allscripts actually is still very commonly used with a lot of physician offices, and so it's been around since the 70s. In the 80s, as technology and information became more of an issue, the Health Level 7 was begun. Now that is an international nonprofit organization, and they really are, their focus is to standardize delivery of information, delivery of care. So there was really this push of getting everybody all on the same page. Then in the 90s, as computers became more mainstream, you see that the National Academy of Medicine actually had a grand goal. They wanted all physician offices to have an electronic health record by the year 2000. They missed the mark. You can see actually they only had 18% by 2001 that actually had electronic health records. So they did miss that mark, but it was a great goal. But you know, you think about the late 90s, the early 2000s, technology really began booming. And the federal budget, President Bush really pushed for more money to go into health records and medicine. Then by 2009, all physician offices were required, medical practices were required to have an electronic health record. If that did not happen by 2009, they were facing penalties or fines or not getting the reimbursement. And so that really pushed a lot of the offices to get their EHR. I was actually working as a nurse during that period of time, and it was kind of crazy. That push, it was like they waited and waited and waited, and then all of a sudden in 2009 there was this like crazy rush, and so it was a little stressful, but very beneficial once we got that. Tech boom has happened. You know, you think about in the 90s, we had those big brick phones, we had computers that took up the whole desk. You think about it now, we carry a computer in our hand. Our phones are little computers. We now have pacemakers that can talk to the doctor's office on the phone. We now have cars that don't even need keys. Our doorbells are smart. So everything is smart, and it's led to what's known as the Internet of Things. And the Internet of Things means everything's connected. And then you fast forward, here we are in 2020, global pandemic, and that has really, really pushed the numbers up on the technology being used. So let's talk about some numbers. As far as with practitioners, and I keep saying physicians, and I know I'm actually a former nurse, and I used to hate that when people would only talk about the doctors, because this includes physician assistants and nurses and nurse practitioners, pharmacists, everybody's connected on this. But this particular number here with the practitioners, this actually is from surveys done by the American Hospital Association and also the American Medical Association. There has been growth in hospitals of using telemedicine. From 2010, when only 35% used telemedicine, to in 2017, 76%. So that's double in just those 7 years. That's really more on the monitoring side. So those pacemakers, scan reports, those type things. The American Medical Association did a survey, though, in 2016 to 2019, and it did show an upward trend in usage, but also in enthusiasm. And, you know, you've got to have enthusiasm before you have usage. You've got to have, that's true for anything. You've got to have that buy-in before people start using it. And 87% of physicians surveyed do see advantage with using telehealth. Most of those were in primary care, so not so much the specialists yet, but I do think we'll see that trending upward with them as well. You can see too in those 3 years, just from 2016 to 2019, the growth of televisits doubled from 14% of doctors to 28%. I'll be interested to see when they do the survey from 2019 to 2021. It's going to be a huge jump, I think, just because now, like I said, obviously with this pandemic and everything going on, lots of people are using telehealth now. So it'll be interesting to see those numbers when they get changed. I know just talking to Dr. Riley Burt this week, she has seen, so 2 years ago when she opened her practice and offered telemedicine, she told me she was usually doing 10, maybe 12 telehealth visits a week. She is now doing 20 to 30 visits telemedicine a day. So just in that 2 years, that has jumped, and I think that jump really has just been within the last probably 2 months, but huge jump in her televisits with her patients. As far as patients, there was a survey that I found again through that healthcareIT.gov. surveyed 2,000 people, not a huge survey, but a decent size. It was even across the United States, so they did equal regions. Over half of the patients were not even familiar with telehealth. You can see there, over 1,400 were not even familiar with it, and a third of those people said they wouldn't even consider it. I do find it interesting. You can see the age group there, 55 or older, and I think that just speaks to the technology piece. It did say that they were mostly from the southern United States, which I don't really know what to think about that, but I just found that interesting. Their biggest concern, I think that we can all relate to this, they were worried about not getting a correct diagnosis and not getting proper treatment. Almost all of them across the board said they really were missing that personal touch. Of the people that were familiar with telehealth, 19% had tried it, and they were in the younger generation, 25 to 35-year-old age group. They were mostly in the Western United States. So again, not sure exactly what that means, but I found that kind of interesting. 2/3 of them were satisfied with their visit and said they would do it again. Their reasons that they liked it was because they didn't have to be in a waiting room with all of the other sick people around them, so they weren't worried about getting sick. They didn't have to commute, so they didn't have to worry about traffic. And they liked the ability that usually they were able to schedule on the same day. So there was the ease of using it. There are some potential barriers, personal preferences, referencing back to that slide, a lot of the fear. Again, I just said, how is the doctor really going to know what I'm talking about? Or maybe, if they are an older, I think about my father, I love him, but he's in his 70s and he doesn't even have a smartphone, and so he's not going to use telemedicine. So there is a little bit of that fear, but I do think that will change. Insurance coverage, is it covered, is it not? This is a fluid issue right now. Again, Rachel's going to really speak more intelligently on that here in just a second. There we go. The access to technology. Now, televisits do have certain requirements to make them successful. There is still a great digital divide in our country. 40% of our population lives in rural areas, so they're not in an urban or suburban area. The FCC actually reports that there's 34 million people right now who don't have the broadband to support a telehealth visit. They're working on that, but that is a barrier to them using that. So there are some, I know Rachel will probably touch on this, we spoke last week about, there are some creative things that are happening to help those people have connection to that. So she will probably touch on that as well. Anytime you have a computer, there are cybersecurity issues. There are cyber criminals and hackers out there who are trying to get any kind of information they can. And that's been a hot topic in healthcare anyways, as things have gone digital. But this pandemic has really rapidly increased the use of technology. They have increased the use of remote workers and teleconferencing and bringing your own device. There's doctors who've brought their work computers home. There's doctors who are bringing their home computers to the hospital. So that opens up a lot of potential problems. It's great for the patients because you do want patient care to take precedence, but it has opened up a lot of issues. Essentially, we've broadened the attack surface for the cyber criminals. Their target is much, much bigger. And so we just need to be careful. I will go ahead and plug that next week's webinar is actually about cybersecurity. So we won't get into any of that really in detail today, but definitely next week, if you're interested in some ways you can be a human firewall, join us next week. We'll get on more of that. But it is a really potential barrier. If someone gets onto the hospital site and shuts it down, that's a problem. Let's talk about some of the technology needed. You do need a good connection. We mentioned that before. You've got to have fast, reliable internet. Most people who are urban, so living in a city, suburban area, Most places have fiber internet now, very quick, very reliable. You need good, fast download and upload speeds to do this. You can use a cellular hotspot. It's not the best because you can drop. Obviously, we've all driven places and that phone call is dropped. So that's not the ideal place to be using this. Cellular hotspot. Satellite connections are not recommended for this, just because there's that, freezing type thing, that bad connections. That's not something you want to connect to. So having a good connection is key. You do need devices, right? So you do need a screen, but you can use any screen. Laptops, desktops, you can use your iPad, your Surface, an iPhone. Any of those things are able to be used. You obviously are going to need video. So you'll need, most laptops and tablets, our phones all have video, the webcams in them. If you're using desktop, you're going to need a webcam. Webcams right now are kind of like toilet paper, very much in high demand. So good luck trying to get one. But because everybody's needing, how many Zoom conferences have you been on in the last 2 weeks? So you do need that if you're going to be using a desktop. You do need a headset. Well, let me rephrase that. You need something to be able to have good audio and talking with your physician. I would say a headset if you are the practitioner, because you want to be able to make sure that those patients are really understanding what you're saying. And that just makes it a little bit clearer if you're on a headset versus using the computer audio. Portals. Again, we've all probably experienced portals with our physicians, refills, those type things. Easy to use, easy to access, easy to enroll. That's something you want, right? That's true with anything. How many times are you frustrated because you can't remember your password, or you can't get in, or it just, they need 300 different screens to get in? If there's physicians who are looking at portals, looking at that ease of use is very important. You need this to be able to meet not just your staff needs and your needs, but you need it to meet the patient needs as well, especially as we move forward into this being used more and more. It does need to integrate with your electronic health record, your EHR. Most do, but you do want to make sure if somebody schedules an appointment on the portal that you also have notice of that in their record. So just making sure that integrates. You also want it to connect with biodata. And what I mean by that is, will it connect and take in their scan reports and their x-ray reports? But will it also connect to their Apple Watch that's going to have their sleep schedule or their heart rate and their respirations? That's something that so many people are using right now. And so you want to see if you can get it to integrate with that. Electronic health record, yes, that's needed, obviously. This needs to be cloud-based so that it's backed up regularly. You don't want it to crash and then you've lost everything. So you need to make sure that's being backed up. It needs to be encrypted. What that means is it's not just in regular text. So if something was stolen or hacked, it's very difficult for them to read it. And so it needs to be encrypted. Update. Make sure you're using the latest version of your EHR. Antivirus. Every computer, whether we're talking about a physician computer, a work computer, or a home computer, has got to have antivirus. Update. Latest version. You're going to see a theme here. Update. Make sure you're using the latest version of really, I know it's frustrating. If you've got an iPhone, it seems like there's a new update every week. You really do need to do that. You need to update. As far as operating systems go, Windows 7, if you're a Windows user, is no longer supported. So make sure that, I would say this again, not just for work computers, home computers as well. You need your Windows 10 on there. It needs to be the latest versions. There's a theme there. Update. Virtual private network. Again, we're not going to get into a lot of cybersecurity, but essentially this is like a secret tunnel. I know Adam doesn't like it when I use that that description of it because it's too basic. But basically, it's when your information from your home computer is going to your work computer, it's going through a encrypted tunnel so that it's not easily accessed by the cyber criminals. I read somewhere, I think that virtual private network use in the month of March had increased by 124%, which is good. People are now using one, so hopefully that trend will continue even after this pandemic is over. Passwords, please make sure you've updated your password. You're not using your dog's name and your kid's birthday or address, those type things. Use very long, different, nonsensical words, but they need to be very secure passwords. Multi-factor authentication is, again, I know it's annoying when you log into your computer and then you have to go get your phone to put in the code, but it's so important, so important. The theory behind that is something you know and something you have. So that if a hacker has your password, they don't have your cell phone. And so they're not going to be able to get in there because of that multi-factor authentication. So please have that enabled, especially on work computers, medical offices, those type things really need that in place. Very high level for cybersecurity right there. But so telemedicine obviously has a lot of sides, and that's in a really big nutshell, sort of history and the technology needed for that. To have successful televisits, though, there's a lot of facets. And so I'm going to hand this over now to Rachel as I figure out how to get her to share the screen here. But she's going to talk to us more about how to get this covered, how to make sure that this is something that you individually and if your company can use this. So I've made you the host.
Hey guys, thanks for joining today. Big thank you to Sublime Computer Services, Elizabeth and Adam. Thanks so much for having us today. We are the Benefits Group and Solution Point Consulting. Like I said before, we help businesses offer Fortune 500 benefits, no matter the size of the company. We leverage a lot of technology. We love our tech. That's why we always bundle telemedicine in all of our group plans. We make it the same plan available to our individual clients as well as if you were in a group. So it's actually the same price. This is just a little video about our kind of what we do. We are employee experience specialists. So one of the most important things about your employee experience, or most important things to your employees, is going to be their benefits, as I'm sure all of you know. We leverage different types of technologies to make that a smooth process for you. Obviously, small and mid-sized businesses, you know, owners, office managers, they have a lot of hats. So our main goal is to take a lot of that you know, off of your plate, because, you know, people are not a commodity. You've got to, you know, really grow that relationship with all of your employees, and we try to do and help you do that as much as we can through technology, streamlining processes, helping you through your benefits, HR. We do onboarding, recruiting, conflict management, with employees as well. So we kind of do a lot of things. But today we're going to focus mostly on benefits, how to get your telemed you know, paid for, who's paying for that, how best to access it. We do have an individual marketplace. So this is how we help our individual clients access the best options on the marketplace. So here, as you can see on the left, we have everything from, you know, your major medical, telemed is right here. Oops, I clicked and then went to the best. Cancer, disability, dental, vision, anything you could possibly want or need in protection for an individual can be found right here. And this is where an individual would go to find your, you know, your telemed marketplace. So you can just click on here. We'll go with that in just a second. As far as our services that, you know, we help our clients with, both individually and group benefits, health, life, Medicare, retirement planning, we can help with all of those, either in a group or an individual setting. We do leverage technology for our group clients as well. This is an example of our Welcome to Your Benefits onboarding site. This is imperative for small business owners to be able to access their all the information, because there's so much information. You have actually, you can kind of see here on the bottom of the slide, you have your rates, your summary of benefits, that's your medical. You have telemedicine here on the right side, income protection, that's like disability protection. And then you scroll down a little bit here, you can see on your left side, again, this is a, an extension of the medical with your dental rates, vision rates, finding a physician, summary benefits for all of that. Ooh. Uh-oh. Are you guys not seeing my screen? Okay, are we not seeing? Okay, let's maybe go back. Okay, we're gonna go back then if you aren't seeing it here. There we go. This is, let's go back to our medical marketplace. This is the individual medical marketplace on the left side here. This, you can see all the tiles. This is exactly how it looks online. The Telemed marketplace is down here on the left. The website is benefits.place. So try to make it, again, super simple, easy to remember. And you can see all of your benefits individually that you can access. Health, life, Medicare, retirement planning, that is what we specialize in at the Benefits Group. This is your onboarding website. As a business client of ours, we make an onboarding benefits website for free. This comes along with your group plan. You can see now here, hopefully you can see now on the left side, your medical, dental, vision rates, summary of benefits. This is a one-click shop for everybody. So we'll send this out to all of your employees along with a canned email about all of their new benefits, what they can expect, how to get everything set up. And this is something that you can use at any time to access your up-to-date benefits information. Our HR platform is actually free for 30 days, and that's for anybody, even if you're not a current client. This is a great platform to help you be compliant and also answer all the questions about PPP or compliance with all the new regulations that are surrounding with the COVID issue. This gives you a complete HR resource on the phone. You can reach up to 40 experts, HR experts in 40 different levels. All of them have over 10 years experience. And so this is just with one phone call, 12 hours a day, 5 days a week. You have a direct line to a full HR department. So you can get rid of all of your employee liability, because if you have employees, you definitely have liability. So this is something that can help you, curb that, take it off of your plate. We do have an in-house HR consultant that can walk you through all of, the technology that we have, can teach you how to use it as you grow, can also train your own HR, office manager or HR specialists. So we offer a big HR employee handbook. If you just need a couple of hours of someone, HR consulting, that is, what we are here, for. We're here kind of whatever you need to keep you up and running with your HR. Switch back. All right, so telemedicine is one of the, as Elizabeth mentioned before, it is booming right now because, you almost have to use telemedicine to get anything done. And I'll tell you a little bit more about my recent experience as well during all of this. But it is a really budget-friendly way to implement benefits within 24 hours. So that is an individual or a business, group level, either way. On the benefits.place, this is the individual, but this is kind of to show you the cost of the plan. $10 for an individual, $12 for an entire house. So if you have 5 children, everybody's covered for the $12 a month. So very budget friendly. Most of our businesses find that they can, cover this entire cost for them. So in an instant, you're essentially giving incredible access to board certified doctors, specialists, pediatrics, even therapy, mental health services, all for $12 a month for, your family or for, your team members. So in telemedicine, it doesn't necessarily, you can't go there for everything, as Elizabeth said as well. It's kind of another little, spreadsheet of, where do you go when? And in Teladoc, a lot of respiratory infections. You'll see in a second, I'll show you that they have a COVID kind of self-assessment, a lot of allergies, cough, cold, flu, ear infections. So everything that's kind of it's kind of an everyday thing. Teladoc's going to save you so much time and money for those small issues, and also should save everyone money on going to the ER or urgent care. When you have better access to healthcare, you have better care. So if you catch it early, this is really for catching things early, making sure that you don't have to take that next step or, use additional benefits where you're going to get surprise billing and all of that. So I have a good story about telemedicine and how it kind of worked out for two of my clients. It's a favorite story of mine. Both of them got shingles. It's a very, serious illness. My friend, who I know personally, and so that's how I know the story, she was on her way to a concert and, started getting a rash. She had ordered a Teladoc visit in the car on the way to the concert, had a prescription waiting for her at the pharmacy when she got to, the city that she was visiting, and was cleared up, within a matter of hours. Was able to go out, do everything that she wanted to do that weekend. And a couple of months later, I get a call from an employee of a business client of ours. And this is a kind of a little overview of like how you can see where you can upload photos so the doctor can see, what your rash looks like. And shingles has a very distinctive rash, and that's why it's able to be, even though it's very serious illness, it can be diagnosed by Teladoc. But most rashes, and that's, I think Elizabeth touched on that as well a little bit, the dermatology is very big in Teladoc. So a couple months later, had a disability claim come through from a client of ours, an employee. She told me the whole long story. She's never sick, never goes to the doctor, exercises. She was traveling, got a UTI, went to the urgent care, got some medication. She didn't, recover immediately, but because she was in such health, good health, she just thought, we'll just, wait around and see. I'm sure the antibiotics will work their way in. Well, she got actually rushed to the emergency room on Thanksgiving Day. So it definitely wasn't a good holiday for anybody in her family. It was a very serious situation. She was septic, and she stayed for 7 days in the ICU. And then, of course, obviously the cost of, reaching your max out of pocket on an insurance plan, you're doing that if you're going to the ICU, even for a few minutes, probably. But, that is, kind of, how those are just the stories that I hear. Because actually until yesterday, I had never used Teladoc personally. I'm very, I just don't ever get sick. I might have some mild allergies. I do my checkups, and that's really about it. So I've never had a chance actually to use Teladoc, but these are the stories that I hear that, have saved them money. An average cost of non-emergency conditions in an ER is between like $2,000 and $3,000. If you start getting into imaging and those types of, situation specialists, out of network specialists, that is almost 100% probably going to happen if you go to, an ER visit. It's just happening so much more. So Teladoc can really help you save tons of money, get you the care that you need very quickly. It is super seamless. This is kind of a high-level overview of the setup process. You do your medical history, set up your account. So once you get online, sign up for your account, you just go to teladoc.com on your computer, or you can download the app on your phone. It'll open up, look just like this. You'll put in your information. That's just like your name, date of birth, zip code, and male or female, and it will actually find your policy. So you don't need to have a policy number or an ID number. It's so great, so easy. And after you'll set up an ID and a password like any portal, and then you'll do a little medical history. It takes less than 2 minutes, I would say. The consult, you'll pick general dermatology, behavioral health. And then here you can see how the visit kind of looks. So actually a few days ago, I broke out in hives. I had accidentally ingested some expired Robitussin. And at first, the first 24 hours, I was like, it was something I ingested because it was head to toe, like very, fine little bumpy rash. It was kind of annoying, but I was like, not a big deal. I don't have any fever, no cough, no, nothing else is going on. So, and then on the second morning that I woke up with it, I saw the Robitussin on the counter, and I never take any medicine. So that's probably why it's expired. And I was like, that's something that, I normally don't take. And, I had eaten the same thing as, my partner the entire day. So I was like, it has to be. And I looked on there, sure enough, 2018 expired. I was like, oh, great. Okay, well, at least I know what it is. I'll keep monitoring the situation. But then I was like, you know what? I should just do Teladoc. It'd be a great opportunity. So that's what I did. I requested a visit. This is exactly what it looks like. This is what your portal will look like. You'll request the visits. You'll let them know where you're going to be, what state you're going to be. This is nationwide, so it doesn't matter where you are. You can see here on the right side, there is a COVID-19 self-assessment. So that's great. Obviously, very up to date on their, social distancing and issues, COVID issues. And then you can see at the bottom there, phone or video. So you can do a phone call or a video. Obviously, with a dermatology, issue, the video is usually a must. But many people use it for, phones for, many other different types of conditions. So you have that option. You'll test out your video capabilities. Just it's a one-click test now. They'll test everything out, and then they'll give you the green arrow, go ahead. You're on the right side here, you can see your visit is confirmed, and we join a waiting room. And so this is what the waiting room looks like. This is after the screenshot after my visit, but so you can see the provider has left the video visit, but this is where you wait, just kind of sit and wait. And I think my provider took about maybe 8 to 10 minutes. It was not that, it wasn't that long. I had a couple of minutes to upload the photos that I'd taken of my rash. So you can see at the bottom there, that middle box, upload image. That's obviously a really good way also to share with your providers what ailments going on as far as any dermatology issues. So that was about it, really. I had already logged in all my pharmacy information. They ask you when you're logging on what pharmacy you'd like your prescriptions to go to. I didn't have to do anything, tell them anything, went right there, went and picked it up on my lunch break, which was literally the only time of the day that I could get out, from behind my computer. So, it really did save me tons of time, and obviously $0 visits. You don't hear that very often anymore with, group plans, with any insurance, major medical insurance. I mean, you've got at least a copay, and many plans these days don't even have a copay, so you're paying more, towards your deductible essentially. So as you can see, I mean, $0, I was able to see, a physician, get a prescription. I have taken 2 doses and it's just like 100% better. So I'm super happy. And I would call it, you know, a success for sure. And just as all of my clients have called it with their experiences with Teladoc as well. It's just a really good experience. So that's been, you know, my experience both with my clients and myself. So hopefully that was really insightful and informative for you guys. If you know, need any help with your health, life, retirement planning, give us a call, send us an email, smoke signal, whatever. We're here to help for you guys, whatever you need. So we need to unmute you.
All right. Yeah.
You there?
Yes, I'm here. If everybody can hear me. Good. Well, thank you. That's great because I didn't know you had a personal experience to share because that's been different since we've talked. So that's actually, yeah, that's great.
Yeah, I thought it was actually just perfect timing. I mean,
that was
honestly,
perfect timing.
It asked me a really good question when I requested the visit. It asked me, where would you have gone if you didn't have Teladoc? And my answer was like, nowhere. Unless I started getting a fever or something, you know, if there was another symptom, yes, 100%. I would have gone to urgent care because I don't have a primary care physician, you know, so it's, you know, but
great.
Teladoc made it so much easier.
I think being able to see that step by step is great too. So thanks for sharing that. So let's see, have you made me the host? So I can, because what we'll do now is actually, so we've heard from the patient side where she's actually used the actual app herself. And I think that speaks to just having that portal where it's easy to use definitely is so key because that took some stress off of you for sure. So let's hear actually from a doctor and see, am I not sharing? Nope. Got to get my tech guy come in here. Here we go. So that you all can
I had
see
to too.
Dr. Riley Burt to get in here. There we go. All right. So thank you. See, he keeps me in line. Yeah, let me make sure. We're going to make sure you can hear it. And so, like I said, she has been so busy with her own telemedicine practice, seeing those 20 to 30 patients just on telemedicine every day. But she was kind enough to send us a video. So let's hear now how she feels about actually from the physician point of view.
Hello, my name is Dr. Riley Burt, and I practice family medicine at St. Thomas Midtown in the Midtown Medical Plaza. I'm board certified in family medicine since 2001, and I was home with my children for about 9 years. And then after being home with them, I decided to open up a family practice clinic after recertifying in family medicine. When I opened the clinic, I knew that I wanted to do something a little bit different. And I consulted several of my colleagues who recommended that I look at advanced MD, practice management, and electronic health records. So I did, and they had a telemedicine component. I was very excited about that because I wanted to do something a little bit different than just the brick and mortar of family medicine. I found quite quickly that telemedicine was an advantage because there were patients that needed refills in medication or needed a consult for anxiety or depression or just a quick follow-up visit and could easily access that program from their laptop or their smartphone and found it to be extremely convenient in regard to getting patient visits completed. We use a standard fee of $50, and prior to the coronavirus pandemic, we found that patients would use it readily and take a break or a lunch break and be able to go to either their office or the break room and follow up, and that was wonderful. And then during the pandemic, it's been extremely convenient, and a lot of the guidelines have been relaxed in order that we are able to see patients that have colds or cough, flu. And there's a clinical diagnosis for strep, and also simple urinary tract infections. And again, anxiety, all of those things are available on telehealth. And those are definitely the benefits of using telehealth, the convenience of your own home and not having to go into the office and possibly be exposed to patients who have tested positive or are asymptomatic and do not know that they're positive for coronavirus. I see telemedicine being a big part of medicine in the future because it allows us to treat allergies and certain other types of conditions through video conference or telehealth. And I see it being an important part of the spectrum of primary care in the future. The software that I use is Advanced MD. And the reason why I like Advanced MD is because there's a practice management side where you can do all of your billing and coding and submit it right there on the computer. And then also the electronic health record side. They are affiliated with a merchant banker, so then any transactions that you make will go directly into your practice management, which simplifies things for your administrator. I find telemedicine very beneficial, and I see it definitely being a wave of the future.
All right. So again, just she loves it. Like I said, she was on the bandwagon before it really was a bandwagon. So I think that really, for her to say, I think this is going to be a wave of the future, I think is it's going to be interesting to see.
And I'll touch a little bit more about the costs and benefits, because $0 consult fee is not on every single plan. Like she said, there was a $50 copay for her service. If it's wrapped up into your group benefits or your group employer benefits, you should have gotten a welcome packet from whatever teleservice that your group is using. And then obviously the individual side, you do that, all on your own. So you can just go to the benefits.place for $0 consult. There's also other services that you can use, but a lot of them do still have a copay. So we always obviously like free. Free is better than not free.
Well, and no, I think that's a good point though. I mean, obviously there's a lot of different insurance plans. There are a lot of different electronic health records. I mean, you all spoke of Teledoc. She uses Advanced MD. That really, they're all going to work essentially the same as far as, like you said, you showed the ease of using it. And that will all like communicate together. So even if it like 1 year you have, your group benefits are on, Advanced Health, and then 1 year you're on Teledoc. I mean, essentially that's what an electronic health record is. It follows you around. It's got right,
right there together for everybody.
That's the benefit, right? That's store and forward, exactly. So, no, I think that's a good point though. I mean, just because your neighbor didn't have to pay anything when they went, doesn't necessarily mean that you want, but you'll still both be getting good care. But that's where, if you're an employee, you need to just make sure, check with your HR department and find out what your plan is. If you are on the HR side or the business owner, if you're not happy with yours, or maybe your plan doesn't have coverage for it right now. I mean, Rachel would be a good person to talk to as far as even just getting an assessment of that. So
yeah,
it's
absolutely
definitely
happy to help.
Yeah, like I said, right now it's a very fluid issue, the coverage. It's in the news.
And I'll touch a little bit about, if you are a small business owner, it's a very quick enrollment census. It's a census. We just need essentially date of birth, male, female, and an email, and we can group enroll. Your employees, team members will have a coverage in 24 hours or really less than that. As soon as they log on and get their do their medical history,
get their information in.
Yeah, they can absolutely same day get a consult. So it is great. The easiest. And that's one of the misconceptions too, is people are like, "Wow, that sounds too easy."
Yeah.
Too good
There's
to be
that
true.
whole
It's too good to be true.
yeah, too good to be true usually is, but in some cases it's true. So
It's definitely been, in my experience, a really, like I said, it's one of the best tools to have in your healthcare toolbox right now.
yeah, especially
Everybody,
right now.
yeah, you're always hearing about surprise billing. You're always hearing about, how much this and that costs in health care.
Yeah,
And
yeah.
so, hopefully this is a really great tool. Everybody can learn, because yes, I will tell, I understand about the, how many are actually using it out there. Definitely more now, but
Yeah,
before,
I
a
do
lot of
think that definitely, obviously those numbers were pre-COVID pandemic. So it'll be interesting, a year from now when we look at the numbers and the satisfaction of using it as well. I think it'll be interesting to touch on this subject 6 months and a year from now, how things have changed. So hopefully for the better. So we've learned a lot today. So actually, I want to just kind of open that up. Anyone who, I mean, I feel like we've covered a lot, and sometimes that's great because you've got, a lot to digest, but sometimes that can be negative because you've got a lot to digest. So are there any questions or any comments? Has anyone had an experience with using that? Like I said, whether it's benefit side, technical side, definitely bend Rachel's ear. If you've got benefits questions, we can answer some
Yeah, and if
technology
you have
questions.
questions after this, feel free to send us an email, give us a ring, go to benefits.place. That's where you can just browse without having to talk to anybody.
Right. Yeah, there's the no pressure, no pressure. So
Yeah.
yeah, so that's not see, I think, maybe we did such a good job that no one had questions.
Hopefully.
But like she said, I know it was a lot. So definitely, if you do have questions, you can reach out either to us at Sublime or at the benefits group. We can also, or with Dr. Riley Burt. She's a great resource as well. Highly recommend, she's not my physician, but I would totally see her if I didn't already have one. So we will I know we've gone a little bit over time. And again, if no one's got any questions or comments, we'll just kind of move forward. Rachel, thank you so much. This has been great. Like I said,
Thanks so much for having me.
yeah, I enjoyed, like I said, just that personal piece of you actually using it, I think was great. Just put up here, like I said, we are in week 3. We're finishing week 3 of our 6-week series. So next week we are going to touch on cybersecurity and talk a little bit about how to keep the hackers out of your system. Again, suggestions, let us know. We'll make sure and send everyone, like I said, the emails where you can reach Rachel or us here at Sublime or Dr. Riley Burt. And I guess moving forward from that, thank you all for coming and have a great rest of the week and make sure you wash your hands. See you later.
Thanks, guys. Bye-bye.
Bye.